our first speaker, Dr. Hitesh Bhatt. He has many degrees to his cap, MBBS, MD Gynac, LLB, and now an advocate and a medical legal consultant. He is the past chairman of Ethics and Medical Legal Committee, FOGDI. Currently, Dr. Bhatt is a medical legal consultant at various hospitals in Mumbai. He has his own website, consentfordoctor.com. We welcome him to the show to know more about how to save yourself medically, if at all, God forbid, you get into such a soup.
Thank you, Pooja and Himanshu bhai, for nice words. I wish my wife would have heard this, so she will change her opinion about me. And with that, I must congratulate the organizers because in Hindi movie or in any conference, the law comes last. But you have kept the law first, and that should be there in your practice. You have to keep the law first in your practice, and that will save you. So that is the first message I wanted to give you: how to save yourself from medical legal problems. Now, medical legal cases are constantly increasing. The things are good as long as it goes well with the patient. The doctor and patient relationships are like this. But minute something goes wrong and patient will start dancing on your head. Why this has happened and why this was not done. So many questions they will ask. So let us understand what is the definition of negligence. The negligence is defined as to do something which a prudent man in similar situation will not do. We are talking about medical negligence. So we can put it this way, that to do something which a prudent doctor in similar situation will not do. That is called act of commission if you do that. Like if patient requires a surgery on the left eye and you operate on the right eye, no prudent doctor will do the same. If you do that, you are negligent for act of commission. And second part is act of omission, not to do something which a prudent doctor in similar situation will do. That is called act of omission. So you cannot omit to do something, or you cannot commit something which a prudent doctor would have done or would not have done. Now the next query is, what prudent man or prudent doctor would have done? How the prudent man shall have acted? So that answer is very complicated, and that is what we have to explain it to the judge. And how we explain? The prudent man is nothing but a common man like R.K. Lakshman. There is no real prudent doctor or prudent man. It is just a hypothetical situation. And how we convince the judge that what prudent man or prudent doctor would have done? By various ways. If we show them that something is given in the textbook, then if your practice matches with that, you can say that your practice is a prudent practice or a standard practice. Prudent doctor would have done the same. If it is a practice in nearby medical college, and that is why the cases are referred to medical college by the court as well, to check whether your practice is a standard practice or not. If something is accepted by peers, if some doctor gives affidavit in your favor, you can prove it to the judge that you are a prudent doctor. And last but not the least, if something has appeared in an index journal, and if you prove it to the judge, then your practice will be considered as a standard practice. When it comes to standard practice or a prudent man's practice, there are two more parameters which are taken into consideration. The expectation of standard of care are different from a GP and a consultant. So if a patient in your OPD gets heart attack and you are treating them, the expectation of standard of care from you for that particular thing is expectation from an MBBS doctor. You will not be expected to treat him like a cardiologist. The place of treatment given, the place you are working, that also matters while deciding a case. If you are working at a small place, PHC level, or in a village setup, then you may not investigate patient to the extent which the doctor sitting at Mumbai is doing. So that also depends where you are practicing, the area of practice. So that is how the judge will judge you on the basis of all these parameters. Now there is a case from Tamil Nadu, Consumer Redressal Forum, Miss Sujata versus R. Surya Prakash. What happened was there was watering, a pain in eye, corneal ulcer, and initially the culture negative for the fungus on corneal scraping. The second scraping was done, fungal infection was proved, and then the treatment was started. Now infection gone deep during that time, and patient lost the eye, and 9 lakh to 10 lakh rupees were asked. But the doctor gave reference from the textbook, and what reference they gave from this textbook, from page number 210, that antifungal treatment should not be initiated without laboratory evidence of the fungal keratitis. And the doctor said that I was waiting for it to come positive, and then only I started the treatment. So I have never delayed the treatment. It is the mandate in the book which said so, and it was considered that his practice was a standard practice, and the case was dismissed. So you have to find out some logic by from the books or journals or by affidavit, then you can prove your case in the court. Now, what is diligence? Diligence is the defense. Ultimately, diligence will save you. Now, diligence is not defined in the law. Diligence means absence of negligence, right? So, to prove the negligence, three things should be there. There has to be a duty towards the patient. There has to be some damage to the patient, and there should be some relation between that negligence and the damage which you cause to the patient. Now, as far as the duty part is concerned, when patients are seen outside your OPD, there is actually no duty or there is no implied contract between you and a patient. My ophthalmology friend always tells me that wherever I go for some function, some marriage, somewhere, the patients do come to me and say, "Sir, ये आंख देखो लाल हो गई है, ये आंख में से पानी जा रहा है." So they come to me. That type of consultation is not the real consultation. Those patients, even though suffer damage, cannot claim because there is no preview of contract between you and the patient. And when he told me this, I told my friend that this is the only advantage of being gynecologist. In a function, nobody will come to me ever like this. So that is what is preview of contract. There has to be contract between you, implied contract. There has to be some damage, and there has to be some negligence and relation between that negligence and a damage. What are the defenses? One is mode of treatment. There can be different mode of treatment. Like you can cool the noodle by blowing it with your mouth, or you by putting a fan like this. Similarly, there are different modes of treatment. And if you adopt one of them, you are not negligent. Like for cataract surgery, there can be phaco or there can be extracapsular cataract extraction. You can do either of this. And if patient suffers some damage, patient cannot tell that why you did not do that procedure because I suffered this because you did phaco. That patient cannot do. And that is where the role of consent comes. You have to write the alternates in the consent. If you tell all the alternates to the patient and you choose one treatment and patient accepts it, it will be considered that patient has chosen that treatment. And that is why we have to mention all the alternates of the treatment in a consent. Similarly, for glaucoma, there are various therapies, and you can choose any one which is proper for the patient. Now, error of judgment. Error of judgment is no negligence. See, if you see this slide, on the left-hand side, there are fake people. On the right-hand side, there are real people. Similarly, there can be error of judgment. See, this is also one more example of error of judgment. That can happen at Goa, right? This is error of judgment. Error of judgment can happen. And if you err in judging something, then you are not negligent. Only thing is, you have to apply your mind. So over a telephone, if you are suggesting something and then plead error of judgment, then court will not accept it. You have to call the patient, you have to see the patient, and you may do error of judgment because there are many conditions which mimic with each other, right? The red eye will have 1,000 causes. So you can err in that diagnosing that thing, but you have to see the patient and then you can plead error of judgment. Accidents can happen. And when everything is in your favor, you have chosen patient properly, your diagnosis is proper, investigation is proper, method of treatment is proper, and still something goes wrong, it will not be taken against you. And there is a case from White versus Board of Governors of Westminster Hospital. And what the judge said in that case, the surgeon was operating under a microscope and he accidentally cut the retina. So he said the surgeon accidentally cut the retina of the right eye during an operation. He was not held negligent for the accident because he was working under a microscope within few millimeters from retina with due care, and still it can happen. So that was considered as accident, and there are many judgments based on this judgment in India also, where if you can prove that everything was perfect and still patient did not get the result, it will be considered as an accident. Foreseeability means a patient may get sometimes the delayed complications. Now, if delayed complications can be foreseeable because of your act or action or inaction today, they can claim it like delayed complication. If you have done something today, it may lead to, say, glaucoma afterwards. Even if it happens after 5 years, patient has a right to sue you because it is a foreseeable complication of the surgery done previously. But there should be relation between that incidence and the damage. Like there is a case of V. Krishna Kumar versus State of Tamil Nadu. You all must have heard about this case. There was a preterm child, oxygen was given for prematurity, and fundoscopy was not advised or not done. And later on, The doctor tried to make the doubtful documents by writing fundoscopy done and NAD and all. It was the forged documents were created. But the court said that when the oxygen was given to the child, the fundoscopy should have been advised. It was not advised. And when child suffered retinopathy of prematurity, it was held against the doctor. Even though it appeared after 2 years, the court said that in the present case, the onset of retinopathy of prematurity was reasonably foreseeable at the time when oxygen was given. So if late complication also, if it is related, and in this case, some few crore rupees were given to the complainant. So you have to be very perfect in your writing, in your suggesting the investigations, and in your making your case paper. Contributory negligence. Now, what is contributory negligence? When you advise something to the patient and patient do not follow it is called contributory negligence. And for that, it is a good defense. But for that, you must have documented the thing in your case paper. If you document it properly and still something goes wrong, then you can show it to the court that, see, I advised patient for this thing, but patient did not listen. And that will save you from the wrongful cases against you. Now, how to save yourself from medico-legal problem? I have told you these are the defenses which we work, and there are many more which we make our defense on basis of all these things, and we present in the court. Now, there are certain do's and there are certain don'ts for medico-legal problem. The first most important thing is law will never teach you medicine. Many a times I'm getting questions from friends. Can I do this surgery? Can I give this medicine to the patient? Law books will never write anything about medicine. Understand that law hardly talks about law. How can it talk about medicine? It is always learned from our books. But medicine may teach you law. If you don't know the law, something will go wrong, case will be filed, and then you will start reading the books. So you should be thankful to the organizers that they have given you an opportunity to learn the law without having case filed against you. So you can avoid litigation by three things: communication, communication, and communication. And it is said that more you talk with your patient in your consulting room, less you will have to talk against them in the courtroom. Talking more in your consulting room with the patient will have same benefit which you get by remaining silent at home. The similar benefits. It will make other person feel empowered. It will avoid misunderstandings, and it will avoid the legal issues. Always take informed consent. Consent is altogether a different talk, but you must have procedure specific consent, and you have to take proper consent, procedure specific consent from the patient. Casual discussion of the treatment should be avoided. Although I told you that preview of contract doesn't exist in such situation, but it is better to avoid. Review the textbook and medical articles to remain with the current medical practice. You cannot give or prescribe something which is obsolete. Do not criticize other doctor or paramedical staff. Take seriously patient suspicion and feeling. Whenever possible, follow their suggestion. If patient will say, sir, can I take second opinion from this doctor? Then don't say, वहां मत जाओ, वो तो मेरा junior है, मैंने उसको सिखाया है. Let them go, right? If they want to do that. Never give assurance about the results. A beauty can convert into beast, and beast can convert into beauty in no time. If you tell that this patient will not survive and she may attend your funeral, that is what is our practice. So never give any assurance about the results. You have to tell that I am there for anything which will happen to you, but don't give 100% assurance for anything. Document everything, either by handwritten, typed, or computerized. Whatever way you want to document properly. We are very poor at record keeping. When we were juniors, we used to write operative notes that patient was taken inside the operation theater, painting, draping done, the doctor with cap, mask, gown, gloves on. Like that, we used to write operative notes. And when we become senior, cataract done. So that is the surgery notes we are writing. That is not allowed. Maintain your good habits. Visit your indoor patient and make it a habit to enter in your case paper. Never alter the records. Whatever you do, you cannot make tiger out of an elephant. And the judges are not doctors, but they are grandfathers of documents. They will immediately make out. Immediately they will come to know that this is forged. This is written afterwards. The pen is different. Handwriting is different. Sometimes we are taking signature on a blank form and we write below the signature done. Now nobody will do that. Who will write below the signature? Or we write in between the lines. If you are writing afresh, you will not write in between the lines. So do not do any forgery in the case paper. Good documentation is a good defense. Poor documentation is poor defense. No documentation means no defense. You can be bashed like this in the court. Always examine female patient in presence of female nurse or female doctor. Practice within your limits. Do not try to do something which you can't do, right? And if you get legal notice, take medical, legal, and medico-legal advice. Because the general, these are my last few slides and most important message, because all the lawyers, they may be having good name, but they are not having experience in medical legal field. Suppose if I ask Himanshu Bhai to treat a cardiorespiratory arrest, he may not do it because in the best way, best possible way, because he is not expert in that. Similarly, we feel that he is Ram Jethmalani, but he doesn't know medical legal thing. I'm just giving the examples. So what happened? There was a board, only tennis shoes allowed, and one lady went there with only tennis shoes. That is what happens with the lawyer. They don't understand our language. They don't understand our actions. Like in one case of cataract, there was a PC rent and the vitrectomy was done. And the lawyer was asking me, सिर्फ लेंस बदलना था तो फिर ये विट्रस क्यों निकले, ये सर्जरी क्यों किया? They don't understand the way this person doesn't understand. You see, this lady is in some other country, and what she wants you will come to know from her action, right? But that fellow did not understand it. That is what happens with the lawyer who don't understand our action also, that why we do so, why we have done so. And if you want to be 100% safe from medical legal problem, you can start your band, you can become photographer, you can join Bollywood, you can join some sadhu, or you can join Dawood gang. Ultimately, you have to run away and leave medical practice. Then you can be 100% safe from a problem. So I always tell, have fearless practice. You may learn some asana to diagnose your own piles, but you cannot get any way to be 100% safe from medical legal problem while being in a medical practice. My teacher used to tell me, if you do not perforate a single uterus, you are not doing enough MTPs. Similarly, I am telling you, if you do not get a single notice in your entire practice, you are having less patients. Try to increase your OPD, right? So do not panic. Do not keep concentrating on a problem which has happened. You may harm the other normal case. So do not let that thing also happen, right? If ever you need me, I will be just round the corner. And Justice Katsu has said, the law is a watchdog, not a bloodhound. If reasonable care is taken, doctor will not be held negligent. So doctors need not worry. So just continue your journey, not only walking, but dancing like this baby, and have stress-free practice. To have stress-free practice, you must practice to remain stress-free. Thank you very much for patient hearing. Thank you, sir.
Thank you, Hitesh Bhai. As usual, very bold and to the point, no beating around the bush.
Himanshu, I would like to add one thing about the Hitesh. I have heard so many medical talks here, but I could understand only because all the presentations, all the photographs are so impressive that they used to teach without your telling anything. I have organized so many webinars on this medical aspects. Hitesh, you are really superb.
Sir, law is a boring subject.
We will keep your talk in some other conference very soon.
Yes, sir, law is a boring subject. I used to sleep myself in the classes, so I made it interesting.
The way you are explaining your photograph, especially the Goa photograph, the very beautiful photograph, you enjoyed it. And second thing, one thing you told, accidental. Accidental means if you have cut the retina, you say, that we'll discuss you somewhere on other platform in detail because time is short here. But this is really very good for doctors to know that they have to prove that this has been done accidentally, not intentionally. Not any lack of knowledge, but accidentally it has been done. So we have to prove in the court, because I have a case in the court that my lawyer was knowing nothing. I have to go and fight myself over the case, and I won the case. That judge told me same thing. That doctors are coming here, they don't, the lawyer does not know anything. Why don't you fight your case your own?
Sir, that is why I had to give my medical council registration back and become advocate. I was not bad gynec, sir.
You are lucky to leave the doctor, and you are lucky to have an advocate. We are all planning to leave the medical profession.
Sutanshu, he gave a good hint. If you don't want cases, stop medical practice. So, okay, one simple question, Hitesh Bhai, without taking too much time of the panel. Is it mandatory for a private practitioner to have a regular checkup by somebody like you, whether we are following a prophylactic checkup? Yes, audit, sir, a medical legal audit?
Yes, that is what, sir, I am doing now. I am consultant to almost 100 hospitals, and we are doing medical legal audits regularly. And that is why I am here in Hyderabad today for medical legal audits.
Very important. This is what I wanted to stress upon, that you can have a private practitioner also who can medical legal practice, whether my staff is following what is correct to be done.
Right, sir. Because documents only will save you. That's it.
So one question is, video consultation mandatory, or is it equivalent to having normal documentation and normal consultation?
Which video? I rather say that do not take video consent. Always go with the written consent, and whatever is written will be believed. If it is properly written and signed by doctor and the patient with two witnesses, it will be taken as a correct document in the court.
Sorry to ask again,
Witness
but
can be from our hospital. Witness can be our staff.
Yes, anybody more than 18 years of age with sane mind can be a witness, sir.
Hitesh bhai, question was, this thing became very popular in talk shows now. Having a video consent for every patient undergoing surgery, and you are saying it's not mandatory. Very important, because where will you keep all the data? You don't know which one is going to create trouble in next 1 year. That
Sir,
data.
that is why, see, in the court, all across globe, the primary evidence is the evidence which is written evidence. The video consultation, or if it is mandatory by law, say in Organ Transplant Act, there are 3 acts at present where video consultation is mandatory by law, over and above the written consent. That is research. When you want to do some research, and video consultation is must. On organ transplant, or video consultation is must, and in surrogacy bill, they have made video consultation compulsory. Otherwise, it is not. And the presentable thing which you can present as evidence in the court is the hard copy. So you have to stick to that. And sometimes video consultation will go against you. Second thing, video is admissible with the forensic examination of the video, because you can morph the video, you can change the video. So all these things are necessary, you have to do. So it is better you have a written, and that is what is admissible in the court.
Yes,
Dr. Ragini, please go ahead, because Hitesh bhai, you must be knowing Dr. Lahani and Dr. Ragini. All problems land up at their feet ultimately. So the final say, let's hear your point of view, ma'am. What is the right?
Good evening, Dr. Arora sir, who's the president. Hi, Himanshu bhai. Hi, good evening, Satanshu sir. Hitesh bhai, that was a wonderful talk. Hi, Saurabh bhaiya, Rohan, Pooja, thank you for the invitation. Dr. Anshika. Now, sir, it was a wonderful talk. I think where we land into problems while trying to solve the problems that doctors have, and then the consumer cases land up with us. So what you said about documentation is very correct. I just wanted to clarify one point about the witnesses, sir. I think, is it okay if the witnesses are all from one side? Because normally it is like this, that the witness has to be one person from the patient side, which is compulsory. It cannot be all our witnesses, sir, for consent.
The point
and
is,
the consent has to be in the patient's vernacular, as far as I know.
No.
And no.
Let me tell you, because this is a talk on consent, but still I will tell you, I'll clarify these doubts.
Yes, sir.
First thing is, the role of witness is any contract. See, consent is a contract. Supreme Court said in case of Samira Kohli versus Dr. Prabha Manchanda that consent is a contract. In Contract Act, Indian Contract Act, the role of witness to authenticate that I have seen this person signing before my eyes. Witness need not know what is written above. It is between you and a patient. That's it. Surrogate consent or consent of the major or any other person is required when patient is unconscious, patient is not of sane mind, or patient is minor. In these 3 situations, you require consent of guardian and not the patient, right? And as far as the language of the consent is concerned, we have already written a last line in consent that this was explained to me in the language which I understand. But and NABH is asking, NABH has put this thing in our mind that it has to be in vernacular language. Now, if you print the consent in Mumbai in Hindi, Marathi, and English, what if a Tamil patient comes to you? What if Telugu patient comes to you? And if you make consent in all 25 Indian language, what if a Chinese comes to you? What if Japanese comes to you? Can't you operate? And if you make consent in 25,000 global language, what if illiterate person comes to you? Can't he enter into a contract? So the point is, consent has to be, because there is a presumption in law, and that you have to tell to the judge. He may not know this, that if something is written and signed by a person who is of sane mind with more than 18 years of age, he is approving what is written above, because no sane person will sign on a blank form. You understand that? And if the language is a barrier, and I argued this in the court once, where they said that the consent language of the consent is different and patient might not have understood it. I said, sir, if you will allow this case, then I may lose this case, but I will be at benefit, because I will stop paying my EMI, because all forms I signed in Marathi and I am a Gujarati fellow. I will stop paying my electricity bill. I will stop paying my SIM card bill. I will stop paying, and I will send my wife home back, because the marriage certificate is in English. And I don't know, I have to keep my wife for entire life with me. So that is not the argument. See, if something is written and signed, it has to be believed. Otherwise, no contract on the earth will exist.
Everything should be in black and white. That will save.
It has to be written properly and signed by 2 people and signed by 2 witnesses. You show me one example where everything is proper and still the court said that this is not a valid contract. It is not valid on various basis. When you don't write I, doctor dash, patient dash, operation dash, if you leave it blank, then court will say that when doctors do not have time to fill in the blanks, we have no reason to believe that this was explained to the patient. That is what the comment from the judge. So it has to be properly filled. That is required, yes. But otherwise, just because patient did not understand, that argument will not stand in the court.
Why did you have the right lawyer, sir?
You have to, yes, you have to explain it to the judge.